I need Natalie here. I'm the worst selfie taker in the... Okay, here we go. Welcome to Inside Look. I'm Jeff Lyons, joined today by the co-founder and I guess one of the... Are you the chief therapist? Or
I wouldn't say I'm chief therapist.
There we go. We'll name you chief chief therapist, Caron Leader from With Insight. Thanks for joining us, Caron.
Thank you for having me.
Mental Health Awareness Month, so
Yes.
You were top of mind. I thought we're going to get Caron in here to talk
Thanks.
about mental health and things like that.
Yeah.
You want to talk about that, or do you want to talk
Sure.
about something else?
Hey, I can talk about mental health if you like to talk about mental health. It seems like it's topic and what, timely? That's the right word.
Yeah. And there's a lot of questions about it. Of course, with it being Mental Health Awareness Month, there's some people out there that want to know some things.
For sure.
I want to know, though, I'm going to
Okay.
flip the script a little bit.
Okay.
You spend your whole time, most of your time, listening to people.
Yes.
But we want to hear a little bit of your story. How did you get
Okay.
involved, or what drove your career into counseling and psychology?
Yeah. Well, really, initially I was interested in law and thought I was going to go into law, be a lawyer. Did an internship in the probation department here in Evansville. Really enjoyed that experience, but seemed like I had more interest in talking to the defendants than being around the lawyers and the judges.
Yeah?
So I just found them a little more interesting, sorry to say.
In what way?
Just their stories. So I was a pre-sentence investigator, and so what my job was to look at mitigating factors in their lives, and seeing all those things that they had been through was really interesting to me, and how that culminated in where they were at that point in time.
So then you make a big U-turn
I
in
did.
college. And what was that like for you? Because there's a lot more to psychology and social work than there would have been over in law, right? Pre-law.
Well, there's a lot of people, obviously, psychology is in every field. And so whatever you choose to do in life, you need to know about human behavior and psychology. It seemed like a good switch from what I did in undergrad and going into that, because I was really interested in international law too, and doing something where I would be working with people in a more direct way. So it was a good fit. It was a natural fit for me.
So what was your first gig then in the business, so to speak?
Well, I started my career at the AIDS Resource Group here in Evansville. It's no longer in existence, sadly, with some of the funding cuts that we've seen in the last few years. But they serviced folks with HIV and AIDS. And I started that back in the early 90s, so when there were a lot of unknowns about that illness and disease and a lot of stigma and discrimination. And then after that was in school while I was working there. And after that job, I started at the Southwestern Behavioral Health Care and worked in outpatient services there.
Okay.
Yeah.
Was it scary for you going in that first time and, being in there, having to take notes, listen, figure, do?
Yeah. I mean, I think I would be lying if I said I wasn't nervous the first time that you're seeing clients and you haven't had that direct kind of experience. And in our field, they really kind of throw you into that world with, it's like you come out of school and you just start seeing folks who have all kinds of issues and problems, so it can be intimidating. And you're getting supervision, so we have 2 years from the time that we do our coursework and graduate from college until we get licensed. So you're having supervision, but it's weekly supervision. Otherwise, you're spending, 20, 30 hours a week seeing clients with all kinds of issues. And, you supposedly know how to help them.
Right
out of
They
school.
think you know how to help
Yes,
them
they
and
do.
and hope that you
We
do.
pretend like we do.
So talk about the help part of it, again, from your side. I mean, I know for a client, there's some work involved on their part, but then, so you hear whatever that person says, and then you conjure, right? You have to, well, that's might not be the right word, but you know what I mean. You have to then kind of process, think about it, and then come back with something, right?
Yeah.
Is that difficult to do?
Well, like all things in my work, it's a yes and no question. Really, keeping it simple is what is most effective. So it sounds trite and silly, but just listening is a huge part of what we do. Most people don't have somebody who actually sits down and takes the time to really listen and attune to them and be present. And so if I am thinking about what I'm going to do, or I'm thinking about the next thing that should happen for a client, I'm not being present with them, I'm not attuning to them, I'm not going to do a good job for them. So, of course, we're thinking about and analyzing and synthesizing what somebody is telling us, but that often comes in collaboration with the client in an organic way versus me trying to map out what it's going to be. There are some therapy models that try to do that, but I haven't found those too effective, because the minute I think that we should be doing something in a certain way, and a client doesn't think that, then it's wrong, right? It doesn't really matter what I think. It matters what the client thinks is working or not working.
You advanced along, and then you started your own business. You co-founded, as we said, with Insight.
Yes.
And it's a big How long you been going? Like 20,
14 years.
14 years.
Yeah, 14
okay.
years. 14 years there in private practice, about 6 years prior to that at a different practice.
So many therapists, many clients, of course.
Yes.
What's a typical day like for you? Like, how many people would you see?
Now,
if there is
since we employ, we have 11 clinicians total. I see about anywhere from 15 to 18 clients a week. Do supervision for the other therapists that we employ, weekly supervision, and then we do group consults with our employees as well, clinical consults. So my day is broken up between administrative stuff and then clinical stuff.
Okay. And what's the age range like on people that you see?
Myself, I start at 3 years old and see up to whatever age anybody can get in there.
3 years old. Mm-hmm. How do you even begin that process with a 3-year-old?
Same thing, right? Like listening, paying attention, attuning. Of course, a 3-year-old is not going to talk to you, so we do play therapy. And we have sand tray therapy, and we have a sand tray therapy room that we use for all ages, not just children, but oftentimes kids that age. We're going to engage them in that. And that's really about assessing and determining what's going on for a kid that age to see if therapy can be helpful for them.
In the arc of your career, I can't remember if there was Mental Health Awareness Day like in the 80s and 90s.
I'm not really sure when that started.
I wasn't really tuned into that or know if it was around, but what have you seen positively first in the mental health field in what you do from the beginning to where we are today?
Yeah, a lot of changes with the reduction in stigma, for sure, about mental health issues. When I started, there was a lot more stigma with people coming to therapy, any ages, mostly more female-dominated of clients that would come. Now, I have a lot of men on my caseload who are coming on their own volition, not just because a woman in their life asked them to come to therapy, so that's good. Also, younger people are more savvy to what's going on in mental health and more open to talking about what's going on for them and ask for that a lot of times to their parents, like, I need to see a therapist, and there's more opportunities for younger people to see a therapist. Now we have Youth First, which has therapists in all the schools, and so kids can access that in grade school and high school, so that's awesome. So just, I think, that accessibility and the reduction in the stigma, but also we have a lot more therapists in Evansville now. When we started in private practice, there were only a couple, and now there's a lot more private practices, a lot more practices that take Medicare and Medicaid. When we started, it was we accepted Medicare, and that was unique. There were a lot of private practice. There were only like 2 or 3 around that time. And a lot did not take Medicare. Medicaid, it's a different story. At that time, when we started with Insight, you had to have a doctor on site to be able to accept Medicaid, and we just couldn't support a physician, so we couldn't take Medicaid. Now we do. They changed those rules. So the accessibility for people who have traditional insurance or state or government-funded insurance, now they have so much more accessibility to access services, which is an awesome thing.
You mentioned younger clients or people
Mm-hmm.
tend to be a little more savvy about everything. Have you seen, and again, maybe, when there was stigma, not as many young people came forth and said, I'm depressed or I don't feel right, versus today? Do you think there's been like a rise in like anxiety in cases like that? Or do you think it's just now more transparent so people are getting help?
Again, a little of both,
Right.
right? Younger people have a lot of different concerns. I mean, always we've had a lot of different concerns. Sorry about that. But with the advent of social media, these concerns are right in front of our younger generations. And so climate change is a big thing that creates a lot of anxiety in young people. The political climate is also something that it's like, what is my adult life going to look like? It doesn't seem very hopeful.
And I
There's
think
a lot
that's
of
valid.
anxiety.
I mean, I think
It
we
is
all
valid.
worry about that.
Yeah.
I was going to say, I mean, we're of a certain age, I'm assuming.
Yes.
I shouldn't assume, I know,
About the
but
same, certain age.
that's an interesting point because years ago, there wasn't social media, the internet, and things like that. So there was sort of a structure. You kind of
Yeah.
knew how life was
Yeah.
supposed to go. And now, if you look at people, especially who've been born like since, let's say, 2000, 9/11, you had the
Right.
big social
COVID.
meltdown and COVID, and it just one thing after another.
Right.
Historically, I mean, do you think this is probably the worst time to try to have good mental health?
Well, I would say probably the Crusades were a bad time.
Yeah, that was rough too.
Yeah, it's a hard time. There's a lot more awareness of these issues that are facing us. A lot more pressures on younger people too, and adults with social media. How to look, how to dress, what to have, your social economic status. So all those pressures are really in front of us all the time. So I think that is a part of that struggle.
Do you think it's practical, though, to shut all that off? I mean, I always dream of just shutting all that off and going back to 1985. Of course, we can't do that. We
Right.
don't have a time machine. But, I think, well, maybe life was simpler then. Maybe it wasn't. Maybe it was just as complicated, but we didn't know.
Different complications, right?
Yeah, I think so. Something like that. And then you've got AI. You've got
Yes.
this artificial intelligence creeping into all aspects of life. Is that a cause for angst among people that you
I mean, I
see?
think people are anxious about it, whether they're talking about that or not. It's here, and we talk about it almost on a daily basis at our office, determining how we're going to use AI to help us in some of the tasks that we do, and what that might look like as a factor as it changes our industry. I mean, people are using it as adjuncts for therapy. My clients talk about that. They'll use AI to talk about problems, to help them with communication and all kinds of things. It's like any tool. If it's helping and it has some positive attributes, great. If it isn't, yeah, it can be something that can be a factor of distress.
Yeah, that's a hump I can't get over. AI. I want
Really?
agency. I want to have control.
Yeah.
And yet, it makes it very simple. If you got something, you're like, I can't figure that out. It will figure it out for you. But I don't like that. I guess my daughter says I'm old-fashioned. So
Well, I get
have
that. You know,
diagnosis.
I mean, I get that.
Old-fashioned.
It's. I have those fears too. And also, what is it going to do to change our world and the different jobs out there, and what kind of anxiety is that going to create amongst people? I think, like any tool, we have to know how to use it, though. And if we use it effectively, hopefully it'll help our lives. I try to think of it like the advent of just computers in general, and how, we had those huge mainframes, and that was
Oh, yes.
that was it.
Uh-huh. It was in some room somewhere
Right.
at IBM, and nobody
Right.
worried about it.
Yeah.
I remember when answering machines for phones came out, and the first couple I wouldn't leave a message on it because I didn't like that. I don't
Yeah.
answer your phone.
Right.
Why are you so important? And of course now it's ubiquitous. I mean, that's how the world operates.
But now people don't like to leave voicemail either. So
Well, I know. So you mentioned earlier, I was going to loop back around to this. You said that in the beginning you saw mainly a fair number of women and some men, and now more men, and of their own volition that they
Yeah.
weren't forced into it. What's the biggest friction point or hurdle for people to seek therapy? Like, is there a threshold above which it's like, yeah, you really need to see somebody?
Do you mean in terms of the issues they're having or just any barriers?
Just not any barriers. I mean, I'm just saying, like, get off the couch and go see a therapist. Why is that difficult for people to do?
Well, there's still a lot of stigma about therapy, I think, in general, not maybe necessarily about mental health disorders, but oftentimes therapists are not portrayed in a positive light in television shows or movies. I mean, we're always kind of quirks or weirdos or something.
A trope, right?
Yeah,
That's always something.
totally.
Right.
So I think that's part of it. And then not understanding the process. Like, I think a lot of people think we're just going to tell people what to do or be judgmental. And really the process is more about helping people figure out what they need to do, what is the best course of action for them. It really doesn't matter what I think, and it's about helping people come up with their own solutions. And so when people actually get into my office and can have a session and see what it is like, then they can start to understand the process. But getting over that hurdle sometimes can be really difficult, and sadly, what gets people in is a crisis or some other kind of relationship situation that is causing great distress.
It goes too far. In other
Yes.
words, had some intervention been taken earlier,
Yes.
maybe not so much.
Yeah.
You talked about mental health crisis. How do you define that for people that are listening? It's like, well, how do you know if someone is in a mental health crisis?
Yeah, so when somebody's functioning, we look at it really from a perspective of functioning. When people are not able to function on the level that has been their norm, I mean, we all have those days when we don't want to get out of bed or things just seem harder to do, but that's just a one day. It's not lasting for a longer period of time. So we look at the level of functioning changes and the duration of that. And then we're assessing also different kinds of things and how we think and how we're talking, how we're moving. So our behavior follows what's going on in the brain. So if we're super depressed, we might be lethargic. If we're running around and not able to sit down, we might be having some kind of mania. So we're assessing on those levels. And when that functioning gets out of our typical range, then we know there's a problem that might require some intervention.
Right.
Yeah.
And is that calling 911? What is that? I mean, when
Yeah.
someone is in a mental health crisis and you're the observer, the bystander, the neighbor, the family member,
Yeah.
what are you supposed to do?
Yeah, that's a great question because I think a lot of people really don't know what to do. Luckily, we have lots of services and agencies in our community that help in those situations, and the main one being Southwestern Behavioral Health Care. They have a crisis unit and work in collaboration with our police officers, do training with our police officers for crisis intervention. So they have a team that have been trained to help people with mental health issues. So calling 911 is the best thing to do. If somebody isn't quite at that stage and would be willing to go somewhere voluntarily, it's seeking help at a hospital. Here in Evansville, that would be Deaconess Hospital primarily, or Ascension. They do have a mental health unit. And then there's Brentwood Springs in Warwick County.
You were talking earlier about the stigma kind of coming down, and we've made advances. I know, like, for instance, the Sheriff's Department, Vanderburgh County Sheriff, and the Police Department have specialty teams within there. So if there's a mental health crisis, they'll come out, and
Right.
kind of try to,
Yes.
settle the situation out there. What's the best part of what you do? Like, what's the reward for you? Because
Yeah.
it's long hours and it's probably a lot of stress on the one hand,
It
but
can be.
yeah,
Gosh, there's so many rewards. I've been really lucky and feel very grateful for the opportunities that I've had to be able to talk to people and who share their life stories with me. It's really an honor and a privilege to do that work. And I learn so much through them. So I get to see how different people live and have a little glimpse into different lifestyles where I would really only know how I've been raised and, the way that I live. So getting to see that is such a privilege. And luckily, I'm a curious person, so that helps with what I do. But really, it's seeing these stories of resilience, what people go through and what they come out the other side, and their courage to be able to walk into a therapy office. I always tell people it is really one of the most courageous things you can do, because you're putting so much of your vulnerable self in somebody else's hands, and that takes a lot of bravery. Yeah.
You've had a long career, or
Yes.
a lengthy career. Well, I don't mean it that way.
No,
You know what
it's
I mean,
okay.
though. I mean,
30 years.
You've had a lot of time, though, for things to kind of sink in and everything. If you had one piece of advice to people just to try to stay mentally healthy, what would it be? What can you do?
Well, recognize that it is okay not to be all right, and that we all struggle. There's a continuum, of course, of those struggles, and when you feel like you aren't able to take care of yourself anymore, it is not a shameful thing to ask for help, and to reach out. It doesn't have to be a therapist necessarily. It can be, if you're a person of faith, a pastor or somebody in your faith, or a friend, but trying to find somebody that you can talk to and see if they can point you in a direction that may be helpful. In terms of a therapist, letting yourself take that step and be vulnerable and share really what you need to share with somebody. And that means that if it isn't a good fit, that's okay. Like, people go to, there's been lots of people that met with me and it wasn't a great fit for them, and that's okay. Telling me that doesn't seem like a good fit is helpful, so that I can help them find the right person. And also telling your therapist if you don't like what they're doing. Again, if I think that I've just had the best session I've ever had, and the client thinks that it was horrible, it was horrible. So telling the therapist, hey, you're off on that, or I've already tried this, it doesn't work for me, that's fine. It's a collaborative process, and it needs to be. So giving feedback is really helpful.
Caron, I really appreciate you taking time with us
Sure.
today
Thank
here on
you for
Inside
having me.
Look. All right. With Caron Leader from With Insight, I'm Jeff Lyons. Thanks for joining. If you want to listen to all the Inside Look podcasts, you can do that wherever you get your podcast, or you can watch on the 14 News YouTube channel. With Caron Leader, I'm Jeff Lyons. Thanks for joining.